let's go here. Look, and the reason, Minister, I put down this motion today was to bring a level of proportionality and indeed transparency is brought to the debate around the true impact the hospitality sector is having during this pandemic, because I believe that information is solely missing at the moment. And can I thank my colleague Senator Crowe for his intervention today, and can I just say, every time the industry's hopes are raised and then dashed, and that's 5 and now 6 times, the impact cuts deeper each time this happens. And I'm not just referring to financial impact. Our industry at Christmas was blamed for the outbreak, the serious outbreak of the Oxford variant. And everyone in this room knows, and everybody out there in the public domain knows, you're probably more at risk of getting the disease if you're in a public space in a shopping centre that were that packed before Christmas. And let us not forget the number of household parties that were being held before Christmas, and the number of families who gathered for Christmas dinner in a small, close environment at Christmas time. But yet the only thing in the media was, why did you open the hospitality sector? It wasn't just the hospitality sector open before Christmas. All retail opened, all personal services opened. So proportionality and transparency needs to be brought to debate. 7 months on, when our industry, the restaurants and the pubs were about to open again, the only thing in the media leading into it, because of the arrival of Delta, was will or will not the government open indoor hospitality. And then NEPHT produced their modelling, and they referred to a narrow opening of indoor social activities or a wider opening of indoor social activities to the public. That means indoor dining. And then you add the other variable, whether you're vaccinated or not vaccinated, refers to indoor dining, where in fact the doomsday scenario that they gave is, and in my opinion, hospitality will not lead to 680,000 cases of COVID. Hospitality will not lead to 2,127 deaths over the 3 months that they're projected. But the whole of society, and how the whole of society acts in every sector, both in the workplace, out in the public, will lead to that. And maybe the government's message should be around how, if we continue the way we are, it's not just hospitality. If this happens, the whole country will be shut down. And maybe if the government gave that message out there and gave the true transparency behind these figures, people might actually behave better at the moment and might stop being so relaxed as we all have become in the current environment. And my whole point, Minister, I know that the Cabinet cannot answer my question. What percentage of the figures presented in this modelling by NEPHT relate directly to hospitality, to indoor dining? Because they don't exist. These are modelling figures. But the government framed the debate, NEPHT framed the debate around indoor hospitality. And again, we are the sector that has brought this pandemic again. And we are the one that's going to be exponentially cause the increase in the surge in this, which is factually incorrect. So I'm asking that the government and NEPHT are a little more conscious of our industry. And when they present the figures, they present them in a transparent and factual manner, and don't lay the blame totally on our sector. Thank you. Let's go here.
Thank you, Senator. Senator Rabbitt, you've got 4 minutes.
Thank you, Laska Hurlock, and I want to thank Senator Casey for raising this commencement. Senator Casey, I'm taking this commencement this morning on behalf of Minister Donnelly, and really what I'm answering is to ask the Minister to clarify how the data which has been presented by NEPHT and communicated by government relates directly to indoor dining, and specifically in each of the 5 scenarios presented in Table 1. So I'm going to answer to the question that you put down. I welcome the opportunity to address this House, and I would like to begin by highlighting the significant and sustained progress that has been made in suppressing the virus over recent months, in no small part due to the huge efforts of the people across the country. This progress has been sustained during the recent reopening in April, May and June, and our vaccination programme continues to make significant progress. However, the increase in cases of a more transmissible Delta variant now poses a significant threat to the progress. Modelling shows that over the period to the end of September, that had we proceeded with the proposed relaxation of the public health restrictions from the 5th of July 2021, we could see 250 deaths or over 1,500 hospitalisations and nearly 200 ICU admissions in the most optimistic scenario, and ranging to over 2,000 deaths, over 1,500 ICU admissions and nearly 13,000 hospital admissions in the most pessimistic scenario. Even the central scenarios modelled would result in significant mortality and pressure on our hospital system that we just can't contemplate. The models work by examining the levels of viral transmission that occurred in summer 2020 and inferring from that, having factored in the protective effect of vaccination, but also the increased transmissibility of the Delta variant, the likely level of viral transmission had we proceeded with the proposed relaxation of public health restrictions from the 5th of July 2021, including the full resumption of indoor hospitality. The Phase 3 reopening of the 29th of June 2020, which included the reopening of cafes, restaurants, pubs and hotel bars serving foods and holiday parks, was associated with a step change in viral transmission, which was sustained through July and August, with effective reproduction numbers increasing from below 1.0 to somewhere between 1.4 and 1.6. The models assume that the reopening of the indoor hospitality now would lead to at least similar levels of close indoor social mixing and opportunity for viral transmission. This is a reasonable assumption, and it is worth noting that the reopening of the 29th of June 2020 was more limited than the original plan for the 5th of July, as pubs not serving food were opened in June 2020. The model then factors in additional protection of the vaccination, but also additional transmissibility of the Delta variant. The models clearly demonstrated that if the Delta variant had not been introduced, we could safely have proceeded with the planned reopening of 5th of July 2021. However, the models also clearly show that the Delta variant becoming dominant, that the very high risks that increased close social contact in the unvaccinated and partially vaccinated group would lead to a significant fourth wave of disease in terms of cases, severe diseases, hospitalisation and mortality. The epidemiology of SARS-CoV-2 infection in Ireland and internationally shows that the primary sites of transmission are private households, social gatherings, including hospitality and workplaces. They are not independent in that increased social mixing in hospitality and workplaces drives transmission into and between households. It is not possible, therefore, to precisely quantify how many cases, hospital admissions, ICU admissions and deaths are directly attributable to indoor dining in each scenario. Can I just finish this last Cahirla, if you don't mind? However, based on the national and international epidemiology evidence, the resumption of indoor hospitality as a whole is likely to be the major contributor to the increase in cases, hospital admissions, ICU admissions and the deaths in each scenario. The Delta variant poses a very serious risk, and I cannot overstate that. NEPHT advised that the higher risk activities involving significant levels of social mixing indoor environments should only be permitted to those who are vaccinated or immune. On Tuesday last, the Government announced that the next phase of reopening to the economy and society. I'll hand back to Senator Casey. Thank you.
Thank you, Minister. Senator, one minute.
And I thank the Minister for her answer. And listen, all I'm trying to do is get an open debate around the true impact hospitality is having in relation to this virus. And I honestly believe, an example was given the other day of a pub in Waterford and how it caused 200 cases. The pub in Waterford, that was an outdoor event. So we need to bring some clarity around this. Our industry have behaved and responded in the best way that they could during this. So we cannot question how they've reacted to this, and we've tried to bring solution to this. So all I'm asking is that there is a level of transparency brought to the true impact that our industry is having on this pandemic. And I do believe that that is seriously missing at the moment. And all we're doing, and we did it at Christmas, is we're driving this activity underground. We're driving it into uncontrolled environments, which will only actually make matters worse than what they would if the industry was open. Sorry for taking up the time, and thank you, Minister, for coming in today.
Thank you again, Leska Hurlock. And I want to thank Senator Casey, and he is quite right, and we all agree that we need to have an honest conversation about it. And it's not just one sector that has responsibility, and it's not just one group. We all as a society have a responsibility for our actions. And the public health guidelines have not changed since the very beginning. Wearing the mask, keeping your distance and washing your hands. But the government is committed to working with the stakeholders across the affected sectors in the coming weeks, and we must continue to work together to protect the significant progress. Only yesterday, Senator Casey, I was down in Ballina with Deputy Cleary, and like I myself sat outdoors, no different to anybody else. And we have to wonder, what is the next step? It's not sustainable for the industry. It's not sustainable. We need to get businesses back up and running. We need to get the employees back to work. And that is what you're advocating for here today. And that is what we are hearing within government, that we need to find a sustainable solution to get business back open for livelihoods and for the economy. Thank you.
Thank you, Minister.